intermittent also, but the thing is, if you are not good enough in doing it, you cannot control while you are withdrawing
And then
you are,
okay.
yeah.
Okay,
it
so
will
it
be
better
not
maintain
comfortable,
close.
yeah. That's why we maintain 10 seconds. But it's also called, that one is intermittent.
Yeah, I
Like,
can see that.
yeah, like this one. If you are suctioning, it can be intermittent. Okay. Intermittent means you are there, and then when you are pulling this one, you can pull close,
Yeah.
like that. While this one, but the gripping is, sometimes
Yeah.
you cannot control also this one while you are doing this one. So it's fine also that it will be continuous. This is continuous. This is intermittent, like doing that. And this intermittent, yeah. Okay. So, but it is not like you cannot do the other one in a different direction, and the other one also is doing that. So maybe it's hard. Okay. So that is suctioning, tracheostomy, and the oral. That is young core. It's easy for the oral because you just have to suction. And now we are going to do is, but this come more together, suctioning and tracheostomy care. Tracheostomy care means you are cleaning the surroundings of you are maintaining the tracheal, yes, to prevent infection. That's why we are doing tracheostomy care. Okay. So we don't need this one because we already suction the patient. And now what we are going to do is we will do tracheostomy care, or caring of the stomach, or the opening here and changing the tracheostomy time. We have set for this one. So we have a kit for tracheostomy care. This one is separate. It doesn't stay in the kit. So this, you will get this ready as well because you will be needing it. And this is the kit. You will prepare the kit first with your not sterile one. So for that one, you can remove with your not sterile hand, you can remove the dressing. You can put it in a place where you put the dirty ones. You can put some paper also here, or drape, so that it will not make the clothing of the patient dirty. So now you are now ready to touch your sterile field. You can now change your gloves. So remove the dirty gloves and wash your hands and put on the sterile gloves. So you are sterile now. You can touch the inside because these are sterile. So you have to put it out. This was, there is also brush. This is the tie for this one, but we are using the other one. This for this one also, the covering you can, because this one is inside, so you can all put it outside. For example, this one, all sterile. Okay. Now you can put sterile saline water for all on here. Now you start. It's okay now to contaminate the hand because usually it's not. So you have to remove the oxygen because you cannot work with the oxygen in. So first thing to remove is the inner cannula. So this is the inner cannula. Some others, they have disposable inner cannula. They throw it out and then replace it with another one. Let me see if I have the inner. Oh, you don't have. This is what we call the obturator. But this first time. Okay. So replace it, remove it, and then put a new one. Or if there is a new one, no new one, this is reusable, so you can clean it in here, the sterile water or the saline water. You brush it, okay, only once, then throw. If there is secretion more, you can wash again in the water, and then brush again. Okay, so make sure that you rinse. Okay, and then there is water here, right? What I do here is I rinse it also from this water. Then make sure it's clean. Yeah, see, it's clean already. You can use this gauze because this is sterile. So you can, yeah. It's okay for 10 minutes if the patient doesn't have oxygen. That's why you have to be fast. Okay, so it's all clean, no water. You can put it back now. Okay. Put it back. it will click. Okay. So next is you clean the stoma. Here, the wound here. These are the use of this one. You can use this one. This water, we didn't use it, right? So you can use it to clean the surrounding here, yes. Or if not this one, you can use gauze. So you wet the gauze and make sure it's not too wet. So you can one stroke only. You can insert it here and then pull up. Okay, so get another one. You put it here. Then make sure that it is on the stomach for the opening and then pull it up. And get another one. This one you put it in and then down. That is from inside to outside. For here also, from inside going out. If not like what I did that you have to put, you can just use it to like from inside, outside, like that. For inside, outside. So also on the, this one is inside, so you cannot see this coming out. So you can hold it from inside going out, and then from here inside going out. But don't use the same gauze. If you need to
One
use
side
one,
only.
yeah, you can fold and use. Then you can fold again and use like that. So afterwards, if you need to dry, you dry it with a sterile gauze again, the same stroke from inside to outside. So that is now clean. You can also clean this one here because sometimes there are secretions here. So you clean also. Make sure it is clean. You can also use the gauze to clean this one. So afterwards, you clean already the inner cannula, you clean already the stoma, you change now the ties. In changing the tie, make sure that you have the new tie. Okay, for me, I opened the other one because I am the only one changing it. Get also ready for the wet and dry because you need to clean the neck also. So when you are removing this one, you have to hold this because
Make sure
oh, yeah, because when you remove this, and then sometimes sometimes people remove it, and then you are here doing things. The patient cough, it will pop up. So keep your hands here, and then clean this one with your because sometimes this is dirty with wet. You can also have dry. Afterwards, you put now your new tie. Then you have to remove the old one. The same thing, you need to clean the neck. Then put the new one. And remove the old one. See, my hand is still here. Holding. Go. One. Okay. So that's it. And then make sure it's not too tight, not too loose. 2 fingers. Your measurement. And put the new dressing. This one, the purpose of this one is to protect the stoma. This, it's easy to put this without this one. Okay. And then you can put now the oxygen so that the patient can breathe. This is the tie. This is to use to tie also here, but I don't use this one. It's not very hard to put instead of the Velcro. Okay. So afterwards, the patient is okay. You can check the oxygen saturation. Also, if it is okay now, the patient is breathing normally, then you can throw all the things that you use. Okay. These are all disposable. So
That kit is with the hospital or the facility standard, or we can bought it some in
this is they have it in the facility. And this one, that's why it has like this one. It is if they don't
we're
have
using
this
them.
one, use this. That's why it is also in the kit. Okay. So these are separate. It is not included in the kit. So what is included is this one and the this one. But for me, I would rather use this is a separate like this. But if they don't have, don't ask, don't look because it's already here. These are just extra things because these ones are expensive. You know how much is one of this one? at least more than 30 or 40. Just
That's why
once
I'm
a
not
day,
familiar
disposable.
with that. Those
Yeah.
only ways.
And yeah, because this is the coffee, that this is the expensive one. There is cheap one, but they come in like one package, maybe hundreds of it. But for this individual, this is a little expensive. Okay, so you can do now tracheostomy care. Who will start? Again.
Yeah, it is.
It's easy for tracheostomy care. The only challenge here is that when you are doing the cleaning, the patient is coughing, then you will feel nervous.
Yeah. And this one, it's sometimes it's really popping out.
Yeah,
The
that's why you
reality.
have to hold it. Otherwise, if you are not good in doing it by yourself, you have to have one. Two of you will do it. The other one will be holding, the other one will be changing the.
Okay. So everything is complete. Check all your things.
So explain the procedure to the patient.
So explain the procedure by cleaning your tracheostomy. And this is sterile, right, ma'am?
Yes.
Sterile. So when opening, just drop. One or two. Okay. Then now we can change our gloves. To sterile.
The sterile gloves.
The water. Then remove the oxygen. And we can remove this. Oh. And then what do you call this, ma'am?
The inner cannula.
Inner can.
No, you know this the sides.
This one, right?
Yeah. Yeah.
And we clean,
Arrange.
clean, brush. So one more. Clean. So keep it here for a while. Then while cleaning
You can put back the inner cannulas.
we can put it.
Yeah. After you dry, you can put.
Yeah. Then we can clean this inner, out,
Yes.
all, inner, out, throw, one more, inner, out, side, inner, out, throw. And then when we're going to change that,
Ties.
Ties.
Velcro ties.
keep your one hand holding the tracheostomy pulley.
Clean. First
Clean.
the neck. Down.
Clean also here.
Yeah. Clean the back of the neck also. Sometimes it's dirty.
Other side.
You hold the plate there. Because that one here is you cannot see that because it's inside. Yeah, so hold the plate. Yeah.
Okay, put it back there.
The dressing. Put the foam dressing or
Which one?
no at the
At the
yeah, because that one just imagine it is
It's
inside.
inside. Yeah.
And now you can put the oxygen.
Then throw this up. Then check the patient before everything else. Check the patient if she's breathing saturation.
Breathing, oxygen saturation, if you need
Coughing.
suction.
Yeah, suction.
Yes.
So this one, like when you put it, takes how many days before you change?
That's once a day.
Once a day.
No,
Or
you
it
mean
depends.
the which one?
The kids, if
The
so
dressing that is
the
once a
dressing,
day.
Once a day.
But if it is, you can see it in the middle of the day or what it is, there are secretions or blood or dirty, then you can change. It is, the purpose of it is to prevent infection. But for the tracheostomy, you don't change, the tube itself. It's only for the
Because
doctor
it's
or the
inside.
RT. You can clean, you can change the dressing, you can change the ties, but do not remove the tracheostomy tube. Okay? Okay. So next.
So hard.
Prepare your things.
Okay. First, I have to remove my items. I have the box here. Go straight down. My tie. This one, no need to tight unless I change the gloves.
Yeah, not yet. Remove first the dressing here on the patient because that is dirty. That dressing, that foam.
I
The
have to
foam,
remove
yeah.
it.
Remove that because that is the one that is dirty.
Dirty.
Yeah, remove it first and throw it with your
The gloves.
gloves. Yeah. And then change it into sterile one.
So
Okay,
I have to
just remove. Yeah, remove that
remove
one.
it.
Okay, and throw it with your gloves and change it
Okay.
into a sterile one.
So I change.
Yeah.
So only this one that you remove it. Change the gloves.
Yes, because that is
It's
a dirty
dirty.
one. Now,
Now I'm changing my gloves. So I have to remove my
okay, yeah,
So
yeah.
when you remove, you have to bring the oxygen back.
You can put it back until you are ready to do the cleaning. Then you can remove.
Then remove,
Yeah, you can touch all the things inside now because you are wearing a sterile gloves.
gloves. Sterile gloves. And they have my company. I don't know. Sometimes you have to think that we are well.
It's okay because that is sterile now, so you can touch those things and remove, and then put it on the
Okay.
that cover. That is a sterile field. Even the tie, you remove it from there because you are going to put normal saline water in all the containers. Yeah.
I put
Yeah.
inside. They have all of them there.
Yeah. Then pour a sterile.
I put the
Normal
sterile
saline.
inside.
Now you can
Then
start.
after, I have
Remove
to
the
remove the
oxygen.
oxygen.
Your cannula first.
Cannula.
You have to, the sides. Two sides. Two sides.
Okay.
Yeah. Push it and you can remove.
So,
Like this, like this. Okay. Then you can clean.
Check.
There's no water.
Okay. Last one.
No, not first. You have to clean first the stomach.
Before you can remove the
Yeah. The tie is the last one.
the last one.
You wet it with the normal saline. Make sure you squeeze it before
Over.
no water and then clean. Do not pull it up like that.
You don't need to pull it.
Don't pull it up. Don't cover the tracheostomy.
So we have to
Insert it from inside
to
going
outside.
out. Inside out.
That's
Also both 4 sides.
COVID time, so many
Yeah.
in COVID time.
Many people they were on tracheostomy. Then you can dry also with a stir drying because they cannot breathe. That's why they have to do emergency tracheostomy. Good for me, I didn't have that.
Nice.
But I was in the hospital.
okay. So after and then you change.
Yes. You make sure you hold the tracheostomy. How you hold it is you can use your 2 fingers, here while you are removing. Wet and dry. The new one first. You know why I put the new one first? Just in case there's emergency. If you remove it all, and how can you grab things?
Yeah.
You cannot remove it. At least if there is the
Holding.
tie, it's you can hold the tie. Yeah, that is the purpose of that. Don't remove it all. Yeah. These are not like things you cannot find it in YouTube sometimes, but when you have the experience, when you are doing it with patient all the time, you can know the techniques how you will do it. Yeah, different. When you have the experience,
Because
and
in
when you-
between the patient will come with it.
yeah,
They're
they will have.
irritated. They will
My
come
experiences, I was sweating
with
because I am alone,
bleeding when you see
and then
bleeding.
the patient is doing that, and then
You will get nervous. You will get fast because you can breathe.
yeah. And I'm always talking, Mama, just 1 minute, it will be done.
Get scared.
It's really scary. And this is also the thing when you are teaching, like you are not basing only on books,
Yeah.
you're basing on your experience. Because if you are basing only on books, sometimes you cannot relate what you are doing.
In reality, it's not in the books.
Yeah. Even if you are reading and reading, if you didn't do it,
Mm.
you will not it will not remain in your mind.
But this one, the way it is, how you can remove it first. Oh, this one.
Okay.
Like the way it is hard, you can remove it. Oh,
If you because the thing also, if you remove all this untie it, they can stick like
To
this.
other
Yeah,
surface.
on the bed sheet or anything. Then it will be hard again for you to remove. Twisted more because you need to not too loose and not too tight. If it is too loose, it can dislodge the tracheostomy. If it is too tight, it can irritate the skin. So not too tight, not too loose. Make sure it's 2 fingers that goes in. If you need to adjust, you can adjust. You can pull this one. And make sure only 2 fingers will go in.
now class.
Put the dressing. Okay, and put your oxygen bottle.
This one it takes time.
Yeah.
And when you go to facility, they will teach you how to do it.
Yeah, you observe it first. Then there is always a nurse there. You will not do it by yourself.
Okay. Takes time. Somebody.
In the hospital also, they do it like one pair.
Okay. Asa.